The next parameter we wish to discuss is glucose. Our liquozone glucose MR is a single reagent format, stable till expiry. It has a very high linearity of 500 mg per dl. Like the other parameters, it incorporates some special stabilizing formulation called as stabilizone. Our glucose assay can be run on fully automated chemistry analyzers, semi-automated chemistry analyzers, and colorimeters, and it's available in two very interesting pack sizes. For most customers, a pack size of 5 into 100 ml is very attractive because it contains 5 bottles, each bottle having 100 ml of reagent. This avoids thermal issues, contamination issues, etc. And for labs of with a higher volume, they can go for a 1 liter pack, which comes with a single bottle of 1 liter along with the standard. This is the easiest parameter to book in any lab because every lab in India will definitely be doing glucose. Whether it's a small, very small, medium, large, or very large lab, it's a marker for diabetes and general health, and also it's performed before an operation is being done, etc. So it's sold across the year. If you're trying to sell glucose MR, then we have two suggestions. One is that you should look at selling a number of kits at a customer. Don't go and book just one glucose kit. Most customers can give you order together for 5 liters or 6 liters of glucose. So you can book 10 kits, 11 kits and give them a special offer. Also, this is a product which can often be sold also by our distributors. So you can also target your distributors and sub-distributors and ask them to buy this product in bulk at a special price. And the product is very easy to run on any semi-auto and fully auto analyzer. Let's try to understand what is CRP. CRP or C-reactive protein is a protein found in the body whenever we are suffering from any form of a tissue injury, an infection such as a bacterial infection or a viral infection, an inflammation, and even in case of malignancy or cancer. So if you look at the other markers we have discussed, glucose is a marker for diabetes. Uric acid is a marker for gout. Urea and creatinine are markers for kidney damage. Triglyceride and cholesterol are markers for lipids or for heart function. CRP is not like this because CRP is not a marker for any disease. Instead, it is a general marker for most forms of disease. It tells you whether you are suffering from some disease or not. If your CRP levels are high, it means either you have some form of an infection or an injury. So, it is used as a general marker for a disease activity. If your CRP is becoming higher, it means your disease is becoming worse. If your CRP levels are falling, it means your disease is becoming better. It is also used for monitoring therapy response. So let's say your CRP was 24, the doctor gave you some medicine and your CRP became 18. It means your disease is coming down and the medicine is working. And CRP is also used as a method of differentiating between bacterial and viral infections. We do this because in case the infection is of bacterial nature, the CRP levels are very high, and if the infection is of a viral nature, then the CRP levels are high but not very high. Till a few years back, ESR or erythrocyte sedimentation rate was used for general activity, general disease monitoring. However, ESR will increase or decrease in many days. That means if you have an infection, then ESR might increase in 4 or 5 days. And if your infection is over, an ESR might reduce in 7 or 8 days, but CRP is much faster. If you have an infection, CRP will become positive within a few days or within a few hours. And if your infection is treated, then CRP levels will become normal practically within a day or 2 days. So CRP is a much better marker than ESR as a general marker for finding out disease activity, disease status, and therapy response. CRP is not a new marker. It was around for many months and years now. However, so far it was done by a method called as agglutination. Agglutination is a method whereby latex particles are exposed to patient serum. If the particles agglutinate or they form clumps, then the result is what we call as positive. And if no clumps are formed, then the result is negative. That means an agglutination test can only provide results as positive or negative, that is, qualitative results. In some cases, agglutination can also be used to give results which are semi-quantitative, which means not only do we know whether CRP or RF or some other parameter is positive or negative, but we can also get an indication whether the results are high, very high, low, or negative. And it has a certain advantage that this can be performed within 3 minutes without any equipment. You just take some reagent, put patient's sample in the reagent in about 1 minute, see whether there is agglutination or not. If there is agglutination or clumping, the result is positive, else it's negative. On the other hand, now we have new methods which are turbidimetric or immunoturbidimetric, whereby the amount of analyte being measured is proportional to the turbidity created. It is very similar to the Beer-Lambert's law. So by measuring the amount of turbidity, we can know how much of the analyte is present. That means instead of getting just positive and negative results, you will get quantitative results. For example, you will get a value of 12 mg per dl instead of just getting a value that whether it is positive or negative. Immunoturbidimetric tests, in addition to providing quantitative results, are also known to be more accurate but have a limitation that they require a semi-automated or a fully automated analyzer. However, because these analyzers are now available in almost every lab, practically most labs are clearly shifting from an agglutination-based assay to a chemistry-based or a turbidimetry-based assay. Commonly, the tests which are performed by agglutination include RF, CRP, and ASO, and these tests can also be performed by immunoturbidimetry, which has the benefit of giving you actual concentration as a quantitative value and highly accurate results. So the next product that we would like to talk about is our Ozotex CRP Turbi. The reagent comes in a 2 reagent format with a ratio of 9 is to 1. That means if you want to run a test, you will use 900 microliter of reagent 1 and 100 microliter of reagent 2. Our Ozotex CRP Turbi has a wide measuring range of 2 to 90 milligram per liter. One of the huge advantages that we offer in our Ozotex CRP Turbi kit, not available in most other kits, is that we are using a liquid stable calibrator. This means that while on other Turbi kits, the calibrator is provided in a lyophilized powder form and needs to be reconstituted with distilled water. In the Ozotex CRP Turbi kit, the calibrator is liquid stable till expiry. no need of reconstitution is there. Not only does our reagent work in R1 plus R2 method, we can also make a working reagent by mixing reagent 1 and reagent 2, and this working reagent is stable for almost 1 month if stored at 2 to 8 degrees Celsius. Our liquid stable calibrator is traceable to an international standard by the name of CRP 470, which gives it a proof of its accuracy. The Ozotec CRP Turbi can be used easily on any semi-auto analyzer such as URA and also on any fully auto chemistry analyzer. Let's talk a little bit more about the Ozotec's Turbi range. Currently, we are offering three parameters in this range: RF or rheumatoid factor, CRP or C-reactive protein, and ASO or anti-streptolysin O. While all these three parameters have a good demand, the highest demand is for CRP and RF. But one must be careful that RF, even though we offer an excellent kit with all the features, it requires a multi-point calibration and is slightly difficult to run for a non-trained user. On the other hand, our CRP and ASO are very easy to run. They are run in a very similar manner like a creatinine kit is run. The reason we strongly suggest everyone to promote our CRP and ASO Turbi range is that it has a high value per booking. A single kit of 50 ml will cost to a distributor about 2500 rupees. So the end user booking value is very high. There are a lot of customers who are moving from traditional kits like agglutination, latex based kits to turbidimetry kits. If you find a customer who is still doing latex agglutination, not only can you offer our standard latex agglutination kits, you can propose the customer to move to the turbidimetric assay. Within all the parameters, the CRP has very high potential because it is A, having a high volume of workload. Many labs will do hundreds of CRP in a month. Second, every kit has a high value. So a single booking will be for a few thousand rupees. And third, it is very easy to program and operate the test. It works on semi-automated and fully automated analyzers. And remember, CRP is used for diagnosing what is happening with the patient, whether the disease is becoming worse or better, whether the medicines are working or not. And therefore, having an exact value as a quantitative result has a lot of advantage compared to only positive or negative on a latex agglutination kit. So do stress on booking these parameters from the end users, and you should go through the catalog and product insert in detail to understand how to sell it. So while we have covered 7 of our star selling products, one must remember that we sell over 25 such parameters, and there is a potential in selling other parameters as well. But nevertheless, no matter what products you are selling, there are a few general rules that you should look at when you are promoting ozone clinical chemistry. So this is probably a very important slide because the content of this slide is not available in our catalogs, in our discussions, and you must go through this slide very carefully. If you follow the suggestions of this slide, your chances of being a brilliant ozone clinical chemistry seller with excellent sales becomes even higher. So follow these 6 points. First, focus on large value generating focus products. You can have a customer who will give you one kit of Vidal as an order, which will have a value of 200 rupees, and you can have the same customer giving you an order for TG plus cholesterol 500 ml, which will have a value of over 6,000, 7,000 rupees. So focus on parameters which give you a large amount of money value. Second, selling larger pack sizes is generally better. There are three reasons for it. First, when you sell a larger pack size, you get a bigger sale in a single day. Second, a larger pack size is used by a customer for many weeks and months. So even if you do not visit this lab in the next 1 month, you are quite sure your competitor is not entering with this parameter. You have booked the customer for many weeks and months. Third, you are able to offer very good per ml cost advantage to the end user. So he is likely to stay with this parameter for a long time. So the second big point that we would like to tell you is sell large pack sizes. Third, focus on selling multiple parameters. When you're sitting in front of a customer, try selling parameters together. For example, urea plus creatinine, TG plus cholesterol, urea plus creatinine plus uric acid, urea plus creatinine plus total protein plus albumin, SGOT plus SGPT, SGOT plus SGOT plus alkaline phosphatase, TG plus cholesterol plus glucose, any combination, but try to have as many parameters as possible in every booking. Fourth, a very easy thing to do is ensure that customers using our URA chemistry analyzers, our humalizer analyzers, our Reto analyzers are only using ozone clinical chemistry. Just follow with them. Just tell them that the ozone clinical chemistry works better on these machines. So focus on selling OCC on all analyzers that have been installed in your area by Metsos Ozone, whether it's a fully auto analyzer like CSense or a semi-auto analyzer like URA. Fifth, understand that there are a certain number of products which are dealer driven like glucose, Vidal, latex agglutination, RPR, while other products are end user driven such as urea UV, CRP Turbi, TG, ASO Turbi, SGOT, SGPT. So try booking as much as possible these high value parameters, give them to your distributors as POBs, and ask dealers to contribute for parameters like glucose and Vidal, etc. This is the fifth point that we would say. And the last and the most important thing is always use your detailing catalogs and folders for promoting our parameters. Talk about features that we have high linearities, liquid stable calibrators, good stability, long shelf life, excellent quality of results, high accuracy, and once you're about to close the call, always try your level best to get an order on each call that you are making. So always end the call by asking for the order, by requesting the customer to try our products, by giving us a chance, by giving us a repeat order, by trying one of the new parameters that we have launched, etc. And you would see a lot of success if you follow these particular 6 points in your sales calls.